My name is Samantha, and I'm going to talk about the importance of having a screening colonoscopy, when is the right age to have a screening colonoscopy, and what is the best way to prepare for a colonoscopy. Screening colonoscopies screen for precancerous or cancerous abnormal growths, which are also called polyps. Polyps are often non-cancerous, but they can develop into cancer. According to the American Society of Colon and Rectal Surgeons, 15 to 20% of the adult population have polyps. Typically, there are no signs or symptoms when having polyps. Sometimes, though, on rare occasions, you can have rectal bleed, mucus discharge, or change in bowels. People who once had polyps that were found during a colonoscopy are 30% more likely to have growth of new polyps. I did bring in some pictures to show you what a polyp looks like. So I'll pass these to you. This would be a normal colon, and these would be polyps of different size. And over here, we also have a normal clean colon, and then these would be polyps that have grown. So just some facts about colon cancer and why it is so important to be screened with a colonoscopy. According to Medical News Today, colon cancer is the third most common cancer in the world. 5% of the U.S. population are diagnosed with colon cancer in their lifetime. In 2012, more than 50,000 people died from colon cancer. Dr. Chaik Duwabni from Penn Medicine says that the majority of these deaths are preventable if people are having screening colonoscopies, they're getting early detection, and they're seeking proper treatment. So when should you have a colonoscopy? Well, first we'll start with average risk patients. Dr. Samuel Benson and Dr. John Ockenfels, who both practice at War Memorial Hospital, believe that you're considered average risk if you have no family history of colon cancer. If that is the case, you would start having a screening colonoscopy at the age of 50. If your colonoscopy comes out clean and no polyps are found, you would be asked to return to the office in 10 years. On the other hand, you would be considered a high-risk patient if you have an immediate family member who has had colon cancer. An immediate family member would be a mother, father, sister, or brother. In this case, you would start screening colonoscopies as early as age 40, and regardless if your procedure came out with a clean colon or there were any abnormalities that were found, you would be asked to repeat the procedure every 5 years. Your risk increases with age. More than 90% of colorectal cancer diagnosis are in patients 50 years or older. This is what the Center for Disease Control and Prevention says. Next, I want to talk about the preparation for your colonoscopy. This is the part of the procedure that people dread the most. They dread it the most because they're being offered gallons like this where they have to consume it the entire night before. It's a very salty substance, and before they came out with better preps, which were less in volume, this is what many patients had to endure. So the day before the procedure, a preparation would involve clear liquids the whole day prior, not eating any foods, and many patients struggle with this. A gallon like this would be mixed up. It would be filled to the top with lukewarm water the day before the procedure in the morning. You must shake very well. Sit it in the fridge, let it chill in there until 4 o'clock in the afternoon. This is when you would start to consume the prep. You would drink 1 8-ounce glass of this every 10 to 20 minutes until you've consumed the entire gallon. Roughly, patients get done consuming this at about 8 p.m. at night. After that, they are still allowed only clear liquids through the night, but they are to stop everything by mouth 3 hours before their procedure. It's also important that patients follow a low residue diet a few days leading up to the procedure. That means avoiding foods that have nuts and seeds and foods that just tend to linger in the colon longer, because this can interfere with the doctor's visual of the colon. Gastroenterology and Endoscopy News Journal says the quality of the preparation and the cleaning out of the bowels affects the physician's ability to detect 4 polyps. Miriam Martel from McGill University did a trial showing that split-dose preps are actually best when cleaning out patients' bowel movements. So this would be an example of the split-dose prep. Again, you would do clear liquids the entire day before the procedure. You would start the first dose of this prep at 6 p.m. the night before. You would empty the prep solution into the cup. You would fill the cup up with 10 ounces of water, consume this. When you're done this, you would then drink 32 ounces of clear liquid of your choice and be done by 8 p.m. After that, you would do another dose the morning of the procedure, at least 5 hours before your arrival time, consuming it in 2 hours. You have to be sure to have nothing by mouth 3 hours before your procedure so as not to aspirate while under sedation. Your doctors would also instruct that you have no non-steroidal anti-inflammatories 7 days before the procedure. That means things like aspirin, Aleve, and Advil, because any polyps that are removed can cause bleeding if the blood is being thinned by those medications. So I hope I have given you some reasons to go to your doctor and schedule your screening colonoscopy if you're an average risk patient at the age of 50 and if you're a high risk patient at the age of 40. Although the day leading up to the procedure is not glorified, it is a painless way to be screened for colon cancer. This is one of the few procedures that are covered by your insurance company, and patients are encouraged to follow through with preventative care. Colon cancer is usually quiet and shows no signs of itself until it's too late. This procedure is practical and necessary for those who hit the great age of 50.